Alright, so I'll be covering plantarflexion, and so first I want to go over all the muscles that will contribute to plantarflexion. So we have the gastrocnemius, the plantaris, which is behind that gastroc, the soleus, and then some other muscles that contribute to plantarflexion are going to be the tibialis posterior, if I can find it somewhere in here. Oh, back here, the tibialis posterior, your flexor hallucis longus and your flexor digitorum longus will help contribute to plantarflexion. And then as well as your fibularis brevis and longus, which are going to be on the lateral side of the leg, can help contribute to plantarflexion. Also on the opposite side, you have your tibialis anterior, which would be one of the main antagonists that will do dorsiflexion. So for passive range of motion for plantarflexion, you want the patient lying supine, and you'd have your stabilizing hand pretty much cupped underneath or behind the calcaneus, and your mobilizing hand on the dorsum side of the foot, and then you just push down as such, down this way, and then work it back into neutral and come right back down. The joint mob you'd want to perform to increase plantarflexion is a talar crural anterior joint mob, and for that you have the patient lying prone, and then you'd want your stabilizing hand on the anterior side of the talus, and then your mobilizing hand right on top of the calcaneus, and then as you stabilize right here on the side of the dorsum side of the foot, and then you just provide this downward pressure, this downward force, and mobilize the talar crural joint anteriorly. Alright, so next we're going to cover stretching. So if you want to increase plantarflexion, one of the best ways to do that is to stretch an antagonist of plantarflexion. So what we're focusing on here is the anterior tibialis. And the anterior tibialis is going to dorsiflex and invert. So in order to maximally stretch the anterior tibialis is to plantarflex the foot and evert. And then you're going to stretch the anterior tib, maybe about 10-15 second hold, and then back off, and then continue to work that motion to stretch the anterior tib.
Here are some fit principles that you can implement with stretching. So with frequency, you can stretch at least once a day, and with intensity, you do low load, and with time, you can do anywhere just greater than 15 seconds. So I'll do 15 to about 30 seconds in order to elicit that Golgi tendon response so we can get a stretch in that muscle. And lastly, for the type, this would be a static stretch. For a basic resistive exercise, you can utilize a TheraBand. First, you'd have the patient position in a long sitting position on the plinth, and then you'd have them wrap the TheraBand underneath their foot close to the toes. Then you'd have them pull both ends of the TheraBand towards the body to create some resistance. Next, you just ask them to go ahead and plantar flex, so push down into the band and repeat that motion in a controlled manner. In this exercise, you can work the muscles concentrically, eccentrically, and even isometrically if you just ask the patient to push down and hold. One way you can progress in this exercise is to just swap the bands for heavier resistance. Another great exercise is heel raises. If a patient is unable to support their own body weight during the exercise, you can have them within parallel bars and allow them to use their hands to assist with the heel raises. Once the patient is strong enough, you can have them just hover their hands over the parallel bars as they perform the exercise to assist with balance. The great thing about heel raises is that they can be performed in a variety of ways that can hone in on specific aspects of exercise that the patient needs. For example, in this exercise, I have the patient push up with both feet and then lift one foot off the ground and then do controlled lower with the other foot. This exercise right here will focus on eccentric lowering. Another way that you can progress in this exercise is to add some weight and some load. So right here I have some dumbbells within the hands of the patient, and then the patient would just perform the heel raises normally but with dumbbells in the hands to provide extra resistance. Here are some fit principles that can be implemented with strengthening. So with frequency, you'd have the patient perform the exercises at least 3 times a week, allowing them to rest every other day. For intensity, with a TheraBand, you just work towards the patient's tolerance. So you use whatever color TheraBand that they can comfortably tolerate. And the same goes for the heel raises. If you're adding weights, just work towards the patient's tolerance and use the amount of weights that they can tolerate. So for time, you could start off with 3 sets of 10 and just adjust accordingly along the way. So if you're looking to improve strength, then you just do a higher percentage of their 1 rep max with low repetitions. Or if you're looking to increase endurance, you would do a higher amount of sets and high amount of reps with a lower percentage of their 1 rep max. For type, many of these exercises will be dynamic, focusing on concentric and eccentric, but as I mentioned before, you can add an isometric component by having them plantar flex and hold that position.